We've corrected that problem.
It's truly live, one and done.
All right, and we're going in 3, 2, 1. Ooh, beautiful, beautiful. The webinar is now live, and we are happy to join you. We'll join you all today. We are extremely excited. I mean, like I was looking at, I was talking with Alan just a minute ago about how we do these every week and how getting past the holidays was a return to normalcy, like being able to start doing this on a weekly basis, but it became pretty quickly apparent that there is no return to normalcy. This week is anything but normal, anything but. So we appreciate you guys, you folks who've joined, taking time out of a stressful week to sit down and chat with us with regards to what does the leadership landscape look like? What should we be focusing on in 2021? And the reason that we have this particular group of people, this crew, Alan Shoebridge, he's actually been on with us before. He's the director of marketing at Salinas Valley Memorial Hospital. Hey.
Thanks for having me.
But the reason that we were so excited to have him is that shortly after the pandemic, we know that there was a lot of confusion. Organizations, marketing departments, outreach, there was a lot of confusion about whether or not there should be more proactive outreach getting to the market, or if or how long organizations should stand back and wait. Alan took the extremely proactive approach and not only took a bias towards action, but expanded the channels and the methods and the modalities of outreach to be able to educate the market and educate consumers in wherever they are, wherever they're exploring. So the excitement here is, if we look back, we can look back. Hindsight is 2020, right? So if most people looking at their numbers, looking at web engagement and email engagement, probably seeing that there's a higher level of engagement, higher level of interest in these communications. So just wanted to bring Alan back and start off that energy for 2021. Alan, my words can only get so far. Could you talk a little bit about the initial pandemic response that Salinas Valley had?
Yeah, absolutely. And, just as we get started to acknowledging the crazy week this has been, it's hard for any of us to make the right headspace to talk and think about the future, but I think it is, important. Basically, and, I think that we're going to see a kind of a reverse of the year, right? So last year, as we were getting into the year and we were working our plan and things were going along smoothly, and then, March hit basically, and kind of, I'd known a little bit about coronavirus prior to March 1st, but not a lot. I knew we were prepping and doing some things, but who knew the scale, And I would say, between March 1st and the end of the month, we just decided to stand up a lot of communications. Looked at a lot of avenues that we thought about doing, but hadn't done in the past, things like podcasts, things like the e-newsletter. These were on our roadmap, and we were going to launch these things probably by the end of the year or sometime this year. But, we were being cautious. We want to think it out. And we really said, well, the time is now. People need to hear from their hospitals, their healthcare providers more than ever. Let's get this thing going. I have to give major thanks and kudos to my team who just responded really strongly. They've done a nice job. They've been working nonstop since March. Our leadership at our organization has supported everything we want to do. Our CEO has participated in so many things, podcasts, interviews, everything. And so has so many people in the organization. So there's been a really good sense of support for what we're doing and the importance of doing it. And also a lot of this has all started with engaging our employees too. I mean, that's been job one, of making sure the employees are aware of what we're doing, that they're informed, and then we build on that to engage the community.
So Alan, so it sounds like the timeline accelerated itself in terms of deploying e-newsletters and some of the elements that you were talking about. It sounds like the pace of work also increased for your team, right? I mean, it seems like, how did you inspire your team, or how did they work to be able to, because it sounds like you may have shifted strategies in March, and then between March and now, I'm sure there were a bunch of different changes that had to happen. And now, we're in this cycle of vaccines and, do you need to get a second dose? How have you changed the way you work internally?
Well, I think one thing is just, empowering the team to do things, make decisions on their own, experiment with things. It's been a great time to experiment. I mean, one example is, we've gotten really heavy into Facebook Live events, right? Get our doctors out there. And we really hadn't done that. We were we're thinking about it. Let's start doing it. And, one great example is, one of my team members, we were having the vaccine when the vaccine first arrived about 4 weeks ago. We were doing some stuff. We had some media there, and she's like, "Should we go live on Facebook?" I'm like, "Let's do it." And we just went live, and it got huge response, huge. And just one of those things that if you're too worried about being overly cautious and things, you're like, "Well, maybe we shouldn't." I think now is the time to experiment, and now is the time where, again, there's more. I think forgiveness if something didn't go quite right or whatever. You're trying to get the word out. You're trying to support things. So that's been happening. I just think that teams that have a real openness to like, let's experiment. If it doesn't work or we don't feel right about it, we don't have to keep it going. But if we try something and it gets a good audience response, like let's keep doing it right now, because people need to hear from us, and they need to hear it from us consistently. So I think that openness to experimentation, and also again, I talk about it. We talk about failing fast, right? I mean, I think sometimes it's just words that we say, but like, let's try it. Again, it doesn't work, we don't have to stick with it. But if it works and we get a good response, and I'd say, like an example of that is sort of the podcast, right? I have no idea. Like, are people going to want these? Are they interesting? How would we use them? Like, let's do a few. Let's see how they go, and then let's see how we use them. And that's been really helpful. It's been a great internal and external communications avenue. So again, I think I would just say anyone experiment, and don't be afraid to let it go fast if it doesn't work. But if it's something working, like embrace it and keep trying.
Yeah, that's really great to hear. And for the people just joining in, I think that it's a good pulse for them to start for like, hey, what am I going to get out of this conversation? So Alan has experimented with podcasts, with all kinds of with Facebook Live, all kinds of different ways to reach out to the population, because the baseline and why it's valid to conduct these types of experiments or do this kind of outreach, because at a baseline, we know that in this time of a pandemic, people trust their healthcare institutions more so than any other source first and initially. So Alan's doing these experiments to see what the response is on these various channels. So what I'd like for people joining in to be able to get out of it is, when approaching your own market or thinking through what plan you're going to communicate to leadership in 2021, maybe some ideas here would resonate. Jumping into that though, if there are questions, like if you're curious about something that Alan says or some channel, how did it perform? What are the numbers behind that? How did it work? This is an open conversation. You have the little Q&A panel button down at the bottom. Shoot that over to us and we're going to answer it live. We're happy to take your questions. I didn't prepare a PowerPoint. I'm very happy that I didn't have to. So just this is a conversation. You're just out here hanging out with us. Now, just to kick things off just a little bit, just a little bit of a rewind. Last time you were on here, Alan, we asked you very basic question: what is marketing? And you said it's not, well, you said, let me define marketing in terms of what it isn't. It's not ads, it's not media spend. It's specifically about building relationships. Well, now that what we where we've gone since then is now we're deep in a second wave of the pandemic. And we're also seeing national unrest. We're at a very uncertain time right now. So what's changed about how we should be focusing or thinking about these relationships that we're trying to build?
I just think that maybe what's changed is the relationship building piece is even more important, right? So, I mean, to get out of where we are now with the pandemic, we've got to get people vaccinated. I mean, that's got to happen, right? So to have that work, one of the most trusted voices is going to be healthcare providers, physicians, things like that. And I think, also people are going to trust their friends and family when they get it done. But we've really got to start with building a relationship to make sure that we convey to people that, the vaccine is safe, that they should do it. When we have details about how they can get vaccinated, it's really going to be important that we're sharing that information. So I think that building that trust. So right now we're thinking about, we don't have necessarily information to communicate to people about getting the vaccine because it's not available. We don't have a distribution channel right now. But what we can do is start laying the foundation of the vaccine is safe. Here's what we've learned. Our frontline healthcare workers have gotten vaccinated. They're healthy, they're safe. Communicating that stuff. So we build the trust now and deepen the relationships that we already have, so that when we get to the point of like, we actually need people to act, they can go get the vaccine as soon as possible. we're having a vaccination clinic at the hospital next week, whatever the situation is, that we've sort of primed that pump to be like, okay, they're going to trust us, they're going to act. So I think right now we're just in a period of like that relationship piece is more important than ever. And, frankly, still, I mean, it's been tough, but we still need people to be safe. Like we still need people to wear their mask. We still need people not to gather. And that's been a huge issue because often they're not following the advice. And I think, it doesn't mean walk away from the advice. It means keep offering it, try to do it differently if you can. But again, that relationship, it has to keep going and it has to be deeper than ever because again, we're going to need people to trust us when we say it's time to get the vaccine, it's safe, it's available, come to see us, whatever that is. We need that relationship to be really strong.
Alan, sorry, Chris, can I go for it?
Yeah, I was Alan, I just like the way that you phrase it in terms of relationships, because the opposite of relationship is transactions. And if we're looking at it as transactional, then there's no reason for us to make a communication that somebody can't really, there's no real call to action there to do something. But if we're maintaining a relationship, then we're building trust over time. In like when those vaccines and when those things become available, you already have a solid ground to do the outreach. So I just wanted to throw that thought out, but yeah.
Yeah, I do like that concept of what the opposite of a relationship. It's transactional, right? Curious, Alan, you talk about experiments and sort of like being able to, fail fast and the like. It's a different mindset for healthcare, probably, right? I mean, typically it's very healthcare in general. Medicine is very similar to concept, very conservative. So, in one aspect, it's great that been able to accelerate trials of new ways to engage your community. How have you found getting the pulse of the community and what people are thinking about? I mean, people are on, Facebook Live, you just mentioned, YouTube, Reddit, Twitch. It's that people are everywhere. They're engaging in every channel out there. So how are you getting that sort of firm pulse of what the community is asking for?
Well, I mean, I think there's a few things. I mean, one, obviously, like you just mentioned, so social listening type stuff. So actually monitoring what sort of conversations are going on in your social channel and things like that, really important. I mentioned like when we did the Facebook Live vaccine event, we got a lot of comments, a lot of comments. And the vast majority were positive, but you do see little threads in there about, well, someone's raising this issue or whatever. So I think there's a piece of looking at that social listening that's really important. And then I'm a big advocate of survey work. So I think if you have the means or you're working with a survey partner to put surveys in the market every month, every other month, whatever, so sort of take the pulse. And we just did that sort of toward the end of end of November, beginning of December, to really take a pulse on how are people feeling about COVID? Or are they, again, are they scared to come back, whatever. And I know that information has been done nationally, and I do take in that national research. But I wanted to see like what's happening locally, like what is anything different? Are there any trends that are different? I also mentioned, and I can't stress this enough, but understanding what your employees are going through too, because they're the ones that when they encounter the community are going to either reinforce a positive message or maybe do something you don't want. And that's the exception to the rule, but it does happen. But we did a lot of work to survey our employees about feelings about vaccine, things like that. So I just think there's so many ways, both formally and informally, you can gather that information and take that to think about, again, the frequency of what you're doing, certain messages that need to be reinforced in your communications or outreach, things like that. So I think it's a combination of formal and informal type information gathering, basically.
Yeah.
And I'd love to hear, with regards to taking a pulse, if anybody has any comments or ideas on what's worked out for you, I'd love to, like, if you just drop some comments or questions related to that. We did, while we were talking, did get a question from Andy Pollock, which is, in terms of marketing spend on vaccine education, what are the thoughts there? Like, basically, is there additional spend being allocated specifically for vaccine communication versus pre-COVID, or is it like potentially cannibalizing other points of outreach? Just what's the focus on spend with regards to this?
Well, I'm sure that there's differences for others. I mean, there's healthcare systems that are really hurting financially right now, and probably, bringing additional budget to the table is difficult. I think there's probably some that are doing fine and have resources, and maybe they're marshaling that to do a campaign. But, what is happening right now, I would say, is more that dollars are shifting for things we don't need to frankly market. Because honestly, in many places, including here in California, we've really cut back on scheduled surgeries, elective procedures, things like that. Some places can't even offer it at all. So again, the marketing that maybe you had, or you would typically have turned on right now to bring a patient into the facility, like you don't need to be doing that, right? And hopefully you shut that down, or you've scaled it really back to, a few key things where maybe you can get people in. But I think, and what we've sort of done is we've just rechanneled that money into our COVID and our vaccine efforts. So, X amount of dollars that we would be spending monthly to do campaigns, we're going to put it into this messaging. And, I would say, frankly, too, a lot of the support around vaccine messaging is not dollar heavy necessarily. Like, there is a place to run ads and do things like that. Absolutely. But you can do so much sort of organically on your social, on your e-newsletters, on your physician events. There's so much you can do to get this message out. I think organically too, that's a piece of it. So I think there's the right approach is to, if you've stopped other things, funnel that money into this type of messaging. And again, depending on where you're at in terms of education now versus call to action later, but that would seem to make a lot of sense to me. And frankly too, I think a lot of people are still going to be, again, hesitant about getting care, things like they're going to wait until they feel safe. So again, the best time to probably start doing a lot of active marketing again is when we're in a good situation where you can actually accept people to come in and they want to come in. That's when you can kind of flip the switch back to what it might have been in the past.
And any thoughts on that from you, Shizal?
We have a big problem. I think vaccine education has been limited over time. People are just used to the flu vaccine and that cycle of your MMR and all that kind of stuff. And living in a community that is pretty much probably very much an example of the entire U.S. spectrum. My local community Facebook group, there's back and forth. The vaccine was developed really fast, and people saying words like mRNA and you're like, wow, when's the last time a normal person on the street knew what the word mRNA was? Because it's recent. I went to school recently, and when I was in college, that was a new technology. So I don't represent the whole demographic. So there are folks that are starting to use that in their regular words. So if I look at my Facebook community and there's topics about this that are going off for hundreds of comments, it's telling you that they're looking for a trusted voice. So that's what I'm thinking. And I think, Alan, that's where you fill in the blank, because I think that's what the communities want right now.
Yeah.
I just got another really good question. This one comes from Jim Samuel, who I've had the pleasure of working with at eHealthcare Strategy and Trend. So, hey, Jim, thanks for reaching out. As you work to educate your community about vaccines, are you facing any public pushback from people or groups that are against the vaccine?
Well, I think it's so market dependent and community dependent, because I've seen reports of places where it is very hard, very uphill to get acceptance. Here, so far, bits and pieces, again, like you go on Facebook or something, you're going to see some stuff, but not a huge groundswell. One challenge that we are going to have in our immediate market around the hospital is we do have a very Hispanic population. All the national data I've seen says that cultural group is more resistant to getting the vaccine. They have deeper concerns. So we're going to need more education, more outreach. I'm beat into the ground, but we have a Facebook Live coming up next week with a physician in Spanish to really take that audience, try to talk about the vaccine. So I think it's going to depend really heavily on what your community is like. You have differences between urban and rural areas. You have differences between, what your socioeconomic makeup is of your community. So I think, and going back to that question you asked earlier, like there's probably a lot of value in knowing what's the sentiment in your community. So what specific challenges do you have in your community? Because if you are facing a very strong pushback, which I know some communities are, your efforts are going to probably take a lot more diligence and repetition and persistence than places where, again, maybe people are more apt to do it. So it's going to be highly variable, I think.
Yeah. Well, you talk about also communicating to your own employees and I think the LA Times last week had a survey, an article about a survey they did, and it was astounding. Even frontline workers, right, whom everyone assumed would be the ones that are most educated about the vaccine, and like they're seeing in LA County 20 to 40% weren't sure if they were going to get the vaccine, and this is where phase 1A or what have you they have access. Riverside Inland Empire was 50%. And so when you start seeing news like that, all of a sudden you kind of wonder, well, if they're not going to get it, should I? Right? And it becomes a big public health conversation, because it has to be a conversation. It can't just be a one-way street here. So yeah, you're right about that, Alan.
I am a little more hopeful than that story, because I did see that story. I've talked to some colleagues, around the country, and a lot of us have surveyed the employees. And I think what most people found is you had about, and again, specific areas differ. Yeah. Even that percentage, 20 to 40, is pretty big span. But I think what we saw was, 70% of people said, I'm going to get it, no reservations. About 20% of people said, I'm on the fence. Like I might get it. I don't know. I want to know if it's safe, whatever. I think that percentage of people is super malleable, right? So with the right messaging, with the right peer pressure, and for lack of a better word, you see your coworkers getting vaccinated, they're fine. I think that 20% is really in play to go into the yes category. And then you have somewhere between 5 and 10% of people like, I'm never getting it. And those people are probably not movable, right? But if we do end up with something like 80 to 90% of people getting it in the healthcare worker space, I mean, that's going to be significant. That's all you're trying to do. So I think I'm more hopeful than that story, but we'll see. I mean, it'll play out over time.
I think time is going to be the key, like you're saying. I think that's going to be the most interesting aspect. The one side story about that, there was at the very end, they talked about what do you do with the vaccines that you have received, right? And Riverside County was particularly worried. And it's again, this area that we live in is pretty much represents America across the entire spectrum. And all of a sudden on WhatsApp, my mom forwards me, hey, I got a link to these things from my other friends. They're signups for CalVax, right? That you're familiar with the state. And people were spreading WhatsApp messages with links to go sign up for vaccines. And it was spreading like wildfire. And so you do see a community starting to take some of it in their own hand.
Yeah. The more, and I think, the more people who, unfortunately the vaccine rollout was, so much smaller than I think the original projections, that you just don't know enough people who have gotten vaccinated. The more people who get vaccinated, I've seen so many things, you guys have seen this too. So people who have gotten vaccinated, they go on Facebook, they're posting their picture with the Band-Aid over their arm, like, I got it. That's going to help. The more people who are doing that is going to help, because again, your cousin, your friend, they got vaccinated. A month later, you're ready to get the vaccine. They're doing fine. That's going to help a lot, but it's going to take that ramp up of more and more people that we know getting the vaccine to have positive energy.
Yeah. We got a good comment based on that, like Alan kind of biasing towards your more hopeful view. Kelly David commented that her team has actually seen a big increase in people getting the vaccination versus what they responded on the survey that they might not have. So perhaps in that 2 weeks between the time the survey was issued, they saw that flood of social proof and decided to get engaged. And this kind of gives us the opportunity to like flip that question too, which is like, hey, where have you been seeing pushback? Has there been pushback? Well, of all the different causes around pushback, one of them might be in our title, Healthcare versus Hubris. So really just to get pointed with that pushback in the market, or with the people who like you identified as the ones that are more malleable, what has been effective, or have you seen or been measuring any kind of impact there?
I don't think there's any measurement right now, but I would say what I think is the right approach is that consistency and repetition. So again, just getting the message. It's so funny. Like we sent out a newsletter yesterday, and we got a response back from someone who's like, oh, I haven't seen the healthcare system sharing this kind of information before. This is great. Now, that person has probably got our message 10 times. Finally, she opened it up. Finally, she's getting it resonated. But I think there's sort of this bias as us as communicators who are like, oh, we've pushed that message enough. Let's move on to something else. Or like, I'm tired of seeing that. I'm bored. And you're realizing that people you're trying to engage like it may take you 10 times to get someone to open your message, to get them to actually start absorbing it. So I feel like a lot of the thing that we have to be really careful with as marketers and communicators is not giving up too soon, not moving on to new things, not saying, oh, I'm tired, let's go to a different message. You have that consistency and repetition is super important. And I think that's going to be one of the keys, is just staying disciplined and keeping our messages going. And again, not getting to the fact of like, I'm bored, I want to move on to something else. We got to keep drilling it home.
So there's a bunch of roles here that you're fulfilling, which is public health education and communication, but also there still is the revenue generating arm of the hospital. How do the communications here balance out with the responsibilities or duties around revenue?
Yeah, I mean, I think frankly, because of COVID, and our situation now where we're trying to really limit scheduled surgeries, elective procedures, it's really on the back burner, and as it should be, honestly, because we only want people coming into the hospital that need care. But where there's opportunity is to make sure that I think you got your plan, your priorities, and your ideas and your tactics and your measurements sort of laid out, so that again, when the time comes to say, we're ready to start what we were doing, we're ready to go back to looking at that revenue generation piece and how marketing can support it, that we don't waste a lot of time turning the switch back on. So I think if you have capacity right now, you should have that plan sort of laid out. You should have things built out. And if you had the right conversations in the fall about, again, what's our sort of plan, maybe before the recent surge hit, you probably got some of that stuff ready to go. And it's just as a matter of ramping up as quickly as you can. So right now, again, you can lay out, if you don't have a plan, you can build one. If you don't have creative, you can start developing it. Again, I think there's ways to just prime yourself to help the organization as soon as they're ready to shift back into that mode.
And unfortunately, I hate seeing it 12:27, 3 minutes left. I hate that, because we could go for an hour on this easily. But so of all the things that we've discussed and the capabilities and strategies that we're enabling, how does technology support that, or what marketing technology are you focused on in 2021 to accelerate these efforts?
Well, I think, if we go back to a second for sort of like the more traditional revenue generating stuff, there's a lot of opportunity to dig deeper into your patient data to get people the right interventions, the right messaging. I don't know if that's something you can do with COVID or the vaccine. Maybe I'm going to give it a lot more thought, but I think there's things that we could do to, again, get more people active, work on retention, serving up the right messages. So before the recent surge, again, this is a super simple tactic and it might not be that surprising to people, but you can look in your patient data for people's birthdays, and annually you can send them something that says, if you haven't had your annual checkup yet, or if you're thinking about, if you fall into a certain age group, what sort of messages do you need to see? If you're in one age group, it's simple, it's more straightforward. If it's an older age group, maybe we're talking about certain service lines, whatever. But even things like that are really simple, but they help build the relationship or maintain the relationship. And then, even getting more, I think, granular of, again, are there certain things we can look at in the data where people have presented with a code that we can send them certain information about care they might need? So that, and again, a lot of health systems are already making progress there, getting into that. And, COVID is sort of put it on hold, but I think that's just going to become more and more important, using your data to reach out, figuring out some segmentation, things like that. And again, as an industry, we're a little bit behind on that, but we're catching up. And so people who do have the tools, I encourage them to think about that. If you're looking to invest in those tools, the time is good. I mean, use some of this time to do your planning and things like that. I think that's an opportunity right now.
One thing I would maybe even put out there for the audience, I think we have the power to do something big from a marketing and a communications perspective. If we look at the year we just went through, cancer diagnoses are down 50%. We didn't solve cancer last year.
Yeah.
Diagnoses are down 50% across the top 6 cancers. These people didn't disappear. It's that screenings are down 85, 75, depending on cancer type percent. Our job now is to kind of get back the system because to get people in the door that have the highest risk, right? And to your point, Alan, let's use the data to get the people that have the greatest risk in as soon as possible once things start opening up, because cancer doesn't go away. And the earlier you capture it, obviously, the earlier you can treat and a better quality of life. And I think that's that's the next big goalpost for marketing leaders.
Yeah, I think that's absolutely right.
So, Alan, we covered a ton of ground today, and I'm thankful every time that you come on and are so transparent with what you're doing at Salinas Valley, especially with the audience here, being able to take that back to their respective communities and ask the questions, do the social listening, and kind of, hey, well, it worked out over there. Let me try this in this market. So just to help out with that, like for people, like now our 30 minutes are almost up. So final thoughts that you'd like for people who attended this to walk away with?
Well, one thing, and this is high level, but earlier this week, before the week went totally crazy, I did a blog post about thinking and your framework for your thinking, and I said, ask yourself 4 questions at some point, at any point. You can do it today, you can do it next week, whatever. It's like, what am I doing? Why am I doing it? Can I do it better? And if so, let's do it better. And I think that's a good framework to use for your personal assessment of your life, for your work, for your marketing plan, whatever it is. So I just encourage people that whenever you get the bandwidth and the space to take a little bit of a breath, step back, ask those questions. What am I doing? Why am I doing it? Can I do it better? And use that lens to look you through for the rest of 2021, because 2021 is going to be tough. It's going to be, especially a start to it. But anytime you can step back and ask those questions, I think it's super valuable exercise.
Fantastic. So a couple of things, if you wouldn't mind, if you could drop that link to that recent blog post, a really good post, if you could drop that into the LinkedIn Live event. And also perhaps for the audience who might not have seen the Facebook Lives that you're doing or have questions about that, perhaps a link to one of those sessions would be really helpful too, just for other ideation that people have in their market. But again, we're a little bit over, but Chital, just wanted to give you the opportunity to share any final thoughts too.
No, I think Alan's right. I was just excited and inspired actually. So I'm actually looking forward to joining that Facebook Live and seeing how the community interacts these days. So thanks for sharing, Alan, your experience and the journey that you've been through, and I'm inspired by what your team's doing out there.
All right. Well, thanks. I appreciate that.
So we really appreciate that. We've recorded this conversation and we're going to chunk it up into chapters for you. So if there's parts that you want to share with teams or your peers or others in your organization, feel free. You'll be getting that link either later today or early next week. And we've got a lot of great stuff in store. We're working on some communication, some future webinars that'll have you talking to people that are working on the front lines of vaccination. We'll be talking to disruptors in healthcare and things like that this year. So stay tuned. And again, we like to keep it open for you to join in these conversations. Thank you guys very much. And hope that this has been a little oasis of sanity and calmness in an otherwise insane week.
We'll see what the afternoon brings, right?
I'm over-promising here.
Yeah.
I know, it sounds like a title of a podcast. All right.
Thank you.
Thanks, Alan.
Thank you, guys.